What's up, moms? Welcome to Mom's Diary. This channel will mainly be about pregnancy, lifestyle, and parenthood. Normal versus cesarean. Pregnant mothers giving birth should know this. Giving birth is a beautiful natural process because the mother is fighting with her life for the little one. Before giving birth, doctors usually judge the condition of the mother and baby in the womb. The doctor can then determine whether you should have a normal or cesarean delivery. A normal delivery may reduce the risk of bleeding and infection. Talking about the normal delivery process, it could be physically demanding, but there are a few advantages that need to be remembered, which are: first, the mother could quickly recover. If there are no complications, the mother could be discharged from the hospital within the next 24 to 48 hours. Second, the mother doesn't need to face surgical risks like bleeding, infection, anesthesia reaction, prolonged pain, and surgical stress. Third, the mother could immediately see and breastfeed their baby as soon as it was delivered. Fourth, the baby will face less risks of health problems like breathing problems, allergies, asthma, and lactose intolerance. A cesarean section is performed by making a cut on the mother's stomach and womb, whereas the cesarean method allows the mother to avoid prolonged contractions. There are a few advantages to a cesarean delivery, which are: first, the mother could determine herself the date of birth, so she could choose a fitting date for the birth of her sweetheart. Second, the mother doesn't need to work for hours and the risk of postpartum trauma is lowered. Third, the risk of a sexually transmitted infection from the mother to the baby is very small. Sexually transmitted disease such as syphilis, gonorrhea, and chlamydia can be transmitted from the mother to child via the vagina. Despite the benefits of the cesarean method, mothers who give birth via cesarean usually have to stay in the hospital for a longer period of time because the mother will still experience postoperative pain, which requires a longer time to recover. Even with its advantages, the cesarean delivery method has some disadvantages or risks, which are: first, longer recovery and hospitalization times compared to a normal delivery. Second, the operation causes pain and leaves a scar. Recovery time is also relatively long, ranging from weeks to months. Third, restricted physical activity for at least 6 weeks following the operation. Fourth, anesthetic complications like nausea, sleepiness, dizziness, and headache, even nerve damage. Fifth, postoperative complications such as blood clots, infections, hemorrhage, and even the addition or growth of new stomach tissue, which binds the internal organs together. 6. The possibility of needing a cesarean section during the following pregnancy due to placenta previa. But the mothers who choose normal delivery will also need to be ready to face some risks, like: first, the mother may suffer from prolonged pain in the dissected area as well as anesthetic complications. Second, a cesarean operation could cause the mother to lose a substantial amount of blood and cause blood clots in her body. Furthermore, the procedure may cause damage to the large intestine or bladder. Third, the mother could not immediately breastfeed the baby post-op, which makes the mother unable to emotionally connect with the baby as soon as possible. Fourth, the baby born from a cesarean operation could potentially experience pulmonary hypertension. In short, both a C-section and a normal delivery have their own advantages. It all depends on the mother's and the baby's condition. So, if you want to know some tips and tricks or maybe even some useful stuff to know, subscribe to our channel.